Hi, my name is Tomiwa. I'm a registered provisional psychologist and I work at the Royal Alexandra Hospital. I've worked in mental health for about 9 years, and it's just something that I felt called to do just because of my lived experiences since I was a teenager and coming into Canada, and just all the mental health challenges that I experienced and didn't necessarily have the support I needed. It really inspired me to go into mental health so that I can support other people that look like me that may be struggling and feel alone. So my identity as a Black professional and obviously as a psychologist, it's influenced my journey in healthcare both in empowering and in challenging ways. At times it is challenging to navigate spaces that weren't necessarily created for people like me in mind, but also it can be empowering because I'm in a position where I'm able to recognize stigma in healthcare, call it out, and create some change and advocate for my patients. Okay, I would say Black healthcare professionals, they do a lot of emotional labor that often isn't formally recognized or noticed. So things like even connecting with marginalized patients, things like fostering that sense of trust. I know patients that have talked to me and said that they felt more comfortable because they saw that I was in the room, and I'm sure it's the same with a lot of Black professionals in healthcare. And these things aren't necessarily recognized, but I think we are doing quite a lot to slowly but surely dismantle that distrust in the healthcare system. Black History Month to me personally is a time for reflection. It's a time to reflect on all of the Black professionals that have paved the way for us. They've sacrificed, they've had to deal with such systemic oppression. And so it's a time to reflect on that, but also recognize that the work isn't done yet. February is a month that reminds us to not be complacent with the status quo because there is still so much work to be done. Yes, we've come a long way from the way things were many years ago. However, Black people still face injustices overall. Black people are amongst the least likely to access therapy due to many reasons. And it's just a reminder that not just in February, but every month, we should continue to look for ways to make healthcare more fair and inclusive for everyone.